on the effect of myopia on retinal ganglion cell complex and RNFL thickness. Dr. Maria Mathew.
Good morning. I'm here to present my paper, Cross-Sectional Study on Effect of Myopia on Retinal Ganglion Cell Complex and RNFL Thickness. These are the contents. Myopia is identified as an independent risk factor for POAG. Both glaucoma and myopia are known to produce RNFL thinning. So, interpretation of glaucoma in a myopic patient based on RNFL thinning can be misleading. My aims were to estimate the effect of varying degrees of myopia on GCC, RNFL thickness, optic disc area and axial length. Also to estimate the effect of optic disc area and axial length on GCC and RNFL thickness in myopic patients. It was a cross-sectional study in 117 eyes of 69 patients with myopia. Exclusion criteria of astigmatism more than 1 diopter cylinder, media opacities, pre-existing retinal diseases, ocular trauma, surgery, glaucoma or ocular hypertension patients. Demographic details were taken, manifest refraction was done, detailed evaluation of the eye was done. Measurements, IOP, CCT, axial length by A scan, spectral domain OCT for peripapillary RNFL, macular GCC thickness and optic disc area. This was a macular radius scan for GCC thickness starting from the G1, that is superior sector, till G8 going clockwise, G8 superotemporal sector. Also, optic disc cube scan for peripapillary RNFL thickness in various quadrants, superior, nasal, inferior, temporal, and also optic disc area from the scan. Patients with myopia were divided on the basis of severity of myopia into M1, M2, M3, that is 0.5 to 3, 3 to 6, more than 6 diopters. On the basis of disc area, into D1, D2, D3, less than 2, 2.1 to 2.5, more than 2.5 millimeter square. A1, A2, A3, less than 22.5, 22.51 to 25.5, more than 25.5 millimeter. Appropriate data analysis was done. P-value of less than 0.05 was considered statistically significant. Majority of our patients were female, 69.2%, and most of our patients had a low myopia, 60.7%, and a moderate axial length, 71.8%, and a large disc, that is 49.6%. GCC ganglion cell complex thickness was found to be thickest in the nasal sector and thinnest in the temporal sector, and RNFL thickness was found to be thickest inferiorly and thinnest nasally in majority of our patients. Comparing between males and females, average RNFL thickness was significantly higher in females than males, and average disc area was larger in females compared to males, but not statistically significant. Correlation between myopia and RNFL GCC thickness. There was significant decrease in RNFL thickness in nasal and inferior quadrant with increasing myopia. There was no correlation with GCC thickness. With increasing axial length, there was significant decrease in RNFL thickness in inferior quadrant. No correlation with GCC thickness. With increasing disc area, there was significant increase in RNFL thickness in the inferior quadrant. No correlation with GCC thickness. Discussion. In our study, it was found that RNFL thickness was thicker and disc area was more in females as compared to males. With increasing myopia, there was RNFL thinning in nasal and inferior quadrant. With increasing axial length, there was RNFL thinning in the inferior quadrant. With increasing disc area, there was increase in RNFL thickness in the inferior quadrant. No significant effect on GCC thickness with increasing myopia, disc area, and axial length. In our study, it was observed that the effect of myopia was more pronounced on RNFL than GCC thickness, which is similar to the results obtained by Sunil Ganekal et al. And Shoji et al. However, our result was contradictory with the study by Andi Pratavi et al., which showed significant correlation between myopia grade and GCC thickness. In that study, sample size was small and older subjects were also included. We found that increase in disc area, RNFL thickness increased, but there was no effect on GCC thickness, similar to the study by Samseo et al. In studies by Sunil Ganekal et al., Giacomo Savini et al., etc., it was found that the increase in axial length causes RNFL thinning, similar to the results in our study. In our study, there was no correlation between axial length and GCC thickness, which is similar to study by Otto et al. Conclusion: as the severity of myopia increased, RNFL thickness decreased, axial length increased, which was statistically significant. With increasing axial length, there was RNFL thinning, and with increasing disc area, there was RNFL thickening. No significant effect on GCC thickness with increasing myopia, disc area, and axial length. So GCC measurements can be considered superior to RNFL parameters in detecting glaucoma in high myopic patients. As disc area and axial length showed significant association with RNFL thickness, OCT parameters have to be interpreted carefully in myopic patients with glaucoma. These are my references. Thank you. Age, yes, sir. 25 to 40 years, sir. 40 years. Age will also affect the RNFL thickness. In the contrasting study, they included older subjects as well. Our maximum was around 7 diopters, sir. In myopia,
So high myopia was
high
also
myopia
included.
was also included.
Okay.
Not evenly distributed, sir. Actually, the disc area, we had a lot of patients in the large disc group and also in the moderate axial length and in the low myopia group. So there was a slight verification due. That is, yes, the confound. Thank you, sir. Thank you.